Are you tired of doctors dismissing your symptoms or worse, even making you feel crazy? Even if your blood work comes back normal, it doesn't mean your health is where it should be. Think of your blood like a delivery truck carrying nutrients and hormones, but the real payoff happens when your cells open the package and use what's inside. If your cells are stuck in what's called cell danger response, triggered by stress, toxins, or infections, they go into protective mode. In this state, cells close off and don't properly take in or utilize the hormones or nutrients they need from the bloodstream. Now, this makes the blood work often appear normal, so doctors often miss the deeper issue, leaving you feeling tired, gaining weight, experiencing mood swings, and dealing with other symptoms while other cells remain in a state of limbo. Visit beyondbloodwork.com to learn how you can start changing this in as little as 30 days.
Hey everyone, welcome to the Dr. Josh Axe Show. I am your host, Dr. Axe, and each and every week on this podcast, we dive deep into the science and principles behind how to grow in body, mind, spirit, and take your health and your life to the next level. Today, we're going to be talking about stem cells. We're going to be talking about how to regenerate new and healthy tissue. If you're dealing with chronic pain, if you're dealing with autoimmune disease, if you're dealing with cancer, if you're dealing with any type of chronic illness from diabetes to maybe your child has a learning disorder, we're going to be going through how stem cells and K cells and other regenerative therapies can help you heal and get to the root of your issues. And I've brought in one of the world's leading experts today to talk about the power of stem cells. And here's something else that's important. There are a lot of people talking about stem cells today, but not all stem cells are created equal. If you're going to get stem cells, you need to make sure that you're getting the highest quality stem cells in the world. This is very similar to vitamins and supplements. If you are buying the cheap supplements from the drugstore that are synthetic, it can actually have adverse effects. Versus if you are buying food-based, real food, premium organic supplements, you're going to get what you pay for. You're going to reap the benefits. So we'll also be going through the different grades and levels of stem cells today, along with so much more on today's episode. And as I mentioned, I brought in the world's leading expert, Dr. Rafael Gonzalez, to talk today. And Dr. Rafael, he is a graduate of the University of California, Irvine. He's a PhD. And again, when I came down with my spinal infection, I had a friend of mine, Dr. Dan Pompa, call me, and he said, Josh, you need to see Dr. Rafael. He's the best in the world when it comes to stem cells and K cells and helping people heal and regenerate. And I went to see him, and I really believe that one of the reasons why I'm walking today and I've got my health back close to 100% now is due to this man. So excited to have him on the show. Dr. Rafael, welcome.
Thank you. Thank you very much for having me. I really appreciate it. Excited to be here and, basically discuss what I love, my passion, my purpose of what I love to do is basically cell therapies. Everybody knows about stem cells, but there's so many different cells in our body. They all play a critical role in all parts of healing, all parts of anything regenerative wise, that we have. If you look at, simple things such as somebody's, having a ton of pain, the body has to adjust, the immune system has to adjust because the body wants to consistently be in homeostasis. All of this is basically cells, the trillions of them that are in our body, interacting on a daily basis with so many different cell signaling that goes on from communication from one cell to another, which is actually through one of the things that we're going to talk about today is exosomes, these bioactive molecules that communicate one cell to another cell that make a cell do an action.
Yeah, it's so powerful. As I mentioned, I do want to say again that I've done a lot of stem cell therapy, especially since I've had this spinal infection. And I had a doctor tell me that I might never walk again. I could be permanently disabled from this infection. And it was your stem cells that I believe really helped me get to the point to where now I'm playing pickleball, I'm lifting weights, I'm carrying my daughter, I'm back doing all the things I love. And so tell the audience how it's possible that somebody could be in a position with something like autoimmune disease or something like what I had, this chronic, injury in my body, and now stem cells can help regenerate and heal tissue. How do stem cells work exactly?
So essentially they have the capacity to form other tissues, but the specific cells that we actually use, we now know they more work on guidance cues, meaning specifically like what we just talked about, communication with your body. So they'll come, it's sort of like the analogy of somebody that's a lot younger and a lot stronger and can work out great, and that can, is a lot stronger than you are. And if you're a 60 or 70-year-old person, that person gets in the gym with you and pushes you to your extreme to work out as hard as you can and helps you build that muscle that you didn't have before, or even that personal trainer. So these guys, the stem cells, are there to aid your body to heal and regenerate. They have the capacity to basically sort of change specific cells in your body. They do it by signaling. All they basically do is signal from one cell to another cell because the system is possibly missing something or it's not functioning correctly. Without these particular signals, you can't heal. For instance, simple example is this. We now know this, there's a ton of science out there, there's articles out there that describe individuals that have heart failure, that have cardiac arrest, have a bunch of issues. These guys have a significantly higher stem cell repertoire in their body floating around. But what's the problem? There's no signal there. Mm-hmm. The signal can't actually go and tell, hey, I need you to help repair the heart. It doesn't do that. That's why we take specific cells, which the cells that we use are specifically grown in a specific manner, and these can actually go in and give those right guidance cues and give the right signals to help heal and repair, specifically in the context of the immune system, which is key to all longevity and health.
Yeah, well, you mentioned a word there, longevity, and there are 12 hallmark signs of aging. And one of those is stem cell exhaustion, right? Our body does not have enough stem cells in order to repair and heal itself. Talk to me a little bit about how stem cells specifically help reverse or help that aging process, and why is it that we get stem cell exhaustion in the first place? Obviously, it happens partly as we age, but what are some other reasons?
Well, if you think of what transpires on a daily basis, one of the key things is, for instance, you discuss regularly, a lot of people do, is fasting. Your cells, every single cells in your body, including your stem cells, only have a finite amount of divisions. They divide. At some point, they become what you just said, exhausted. They no longer divide because there's no more of them to actually continue to replicate. So if you can stop that cellular division, if you can slow down that cellular division, then you have a fighting chance. Your stem cells have a fighting chance. Just think of your body on a daily basis. There's a crazy number of cells. There's over 300 billion cells that turn over. That's a crazy number. Every single day that turn over. So stopping that is actually key to longevity. And you look at stopping it in the context of the inflammatory or the entire immune system. The immune system is key to health. There's a term called inflammaging. I wrote an article, actually published an article in 2015 that I shared with you.
I read it. It was fantastic.
Yeah, and it looks at the concept of, as we age, we live chronically inflamed. Unfortunately, when we live chronically inflamed, what ends up transpiring is the immune system's on overdrive. The immune system's going to become exhausted. Now you end up getting things like heart disease, neurodegenerative diseases, which are crazily on the rise, the amount of people that have these. And a lot of it has to do with looking at diet, nutrition, supplementation, the ability of the gut. 60% of the immune system is in the gut. The ability of the gut to absorb correctly. It doesn't do it correctly, so then the immune system is activated, or you lack specific supplements. A lot of people talk about supplements are nonsense. No, they're not nonsense. Everybody has a specific regimen that's dealt for them. Diet is not nonsense. You got to keep on your diet. And ultimately, my diet's going to be different than your diet, but you have to look at what fits you. And that's, my take is everybody's so unique in their personality and their DNA that everybody has a unique, specific supplement blend. Everybody has a unique, specific diet blend that makes you feel you're optimal.
Yeah, I absolutely agree. One of the things you mentioned is once these cells replicate, obviously you're left with some sort of cells at the end. Now, those might be senescent cells, right? Once you get to those, walk me through, maybe as we talk about aging, what is some of the domino or the cascade effect of this causes this to where you end up with stem cell exhaustion or these senescent cells? And what are senescent cells?
Great question. So number one is when the immune system is tapped, when you're, for instance, a simple analogy is, another one is when you eat that extra slice of pizza, what you have to think about is the amount of digestion that has to transpire and the amount of metabolism that happens in the liver. Your cells have to replicate. And at some point, there's no more replication left. The stem cell repertoire that's mostly in the bone marrow and in specific niche tissues has to force a progeny out to replicate to help with that. But at some point, there is no more. That's one. Two, in many instances, the signaling in the body is not there because the body's busy trying to take care of so many other problems. For instance, the immune system. You're being attacked on a daily basis by a bacterial infection, a virus. So many different things are transpiring at one time. The environment, mold exposure, allergies. There's so many allergens now. The food is beyond toxic now. It's a really, really complex. It's just like you're in a ring with a UFC fighter. You're not going to win if you're just a regular person. But if you think of it like this, if that UFC fighter has to fight 5 different people because he's being attacked by 5 different things at one time, that UFC fighter is going to lose, even if your system is up to par. So it basically becomes exhausted at some point because it's dividing too much. The signaling cues are not there, so it's a couple different multiple things that are transpiring, and you can't heal correctly. So that's one. Then at one point when the cells divide out, for instance, we just talked about the liver. The liver becomes cirrhotic, loaded with fatties, fatty liver disease. That is actually a senescent cell. The portions of that are senescent cell. It's a cell that no longer basically can replicate, can regenerate, just occupy space. And we now know that these senescent cells, believe it or not, they're called senescent associated factors, but they're basically exosomes. They're detrimental exosomes that communicate with another cell that cause more damage to another cell nearby. So senescence forces more senescence.
It's almost like an infection that's spreading throughout the body.
Yeah, correct. If you think of an individual when they tell you have another one is pulmonary fibrosis, lung issues, or COPD, chronic obstructive pulmonary disease, it starts off and it's going to continue. It's going to progress. It's a progressive disease, and it's essentially sort of like a senescent cell that basically is just going to signal to other cells nearby, and it's going to cause havoc. The other cells nearby are not going to be able to get better. So it causes more disease. If you think of it, it's now known that the number one killer in the world is actually senescence.
Wow.
Because it actually causes neurodegenerative diseases, heart diseases, cancer. It also causes cancer. Now, it's just a cell, once again, occupies space. It's like an individual is just sitting there doing nothing and causing havoc and causing more problems in your body. These need to be eliminated.
And oftentimes these are called zombie cells, right?
Zombie cells is another method of saying, in your body.
Yeah. And so as Dr. Rafael's talking about here, these senescent cells, they secrete these inflammatory compounds that then age other cells around them. It's like it's sort of this principle that's, it's philosophical, it's metaphorical, but it's real in life. It's you become who you surround yourself with. And so more senescent cells cause more senescent cells, where more healthy cells support more healthy cell creation and growth. And so it's really important that we take care of these senescent cells and activate more of our stem cells if we're going to slow the aging process, if we're going to reverse disease. I've been so blown away at the number of people with I'm going to name several different medical conditions where I sent them down to your clinic in Cancun, which I've been to 4 times myself, and the results were amazing. I had a family member of mine who had psoriasis. He had it for 20 years, went down there, and after 3 months after he got the stem cell, it cleared up 100%. I mean, didn't have it anywhere in his body. It was unbelievable. I had someone else I sent down there who had, like I did. He had 2 discs that were compressed and damaged. A mutual friend of ours. I mean, he saw radical improvements with that. I've had people with inflammatory bowel, like major Crohn's, colitis, inflammatory bowel disease, seen incredible results with that. Of course, my spinal infection. And I'm thinking, someone else now, they got NK cells, which is different, but something else you do. And they had major pain over all their body, endometriosis, infertility issues. And that guy, I mean, that, you know, she was pregnant, had a baby already. So there are so many different conditions that these help with, because, you know, I was reading a few books on anti-aging medicine, and one of the authors said, all disease in a way is aging. Mm-hmm. And it really made me think, what are your thoughts about that?
It is all aging. It's what we just talked about, senescence. You know, it's the fate of age-related. Everything goes towards aging. Your cells only have a certain amount of divisions. They're going to die. They're going to get tired. They're going to become exhausted. You can slow down that cell division. You can live the most robust, healthy lifestyle to slow down that cell division and have longevity. You can use cells. So for me, the most important aspect is twofold. Aging is an immune issue, is one, and aging is actually, more importantly, a vascular issue. Because if the vasculature, as we age, our arteries and veins start to constrict. They become, a lot of people have clogged arteries, calcium buildup. They sort of become sort of shriveled, let's sort of say in essence. And what ends up happening when you don't have the right vasculature? We now lack oxygen because there's no correct blood flow to the organs to help heal. So if you can't increase vasculature in the body, that's why a lot of times, you know, they talk about what's the best thing exercise you can do? Walk. You know, there's probably nothing better than walking on a consistent basis, because you're increasing blood flow and you're getting vital nutrients to the organs, to the brain, to the heart, to all the, you know, the vital organs in your body. And this helps nutrients and oxygenation to these organs to get to where they need to go. If you're stagnant and you don't do anything, what ends up transpiring, especially if you're lacking some of these, you know, you have the small vessels that are somewhat clogged, arterioles, venules that are clogged, the capillaries are all clogged. You now have an issue on your hand.
Now there's a term, immunosenescence. Is there a term for it related to the vascular system?
It's the endothelial cells, are the cells that line the vasculature. Those can also become senesced, where they don't function correctly. So if you think of the lining of the vessels, many times those actually play a critical role in what nutrients come in and out of tissue. They play a really critical role. If they don't function correctly, there's also blood pressure issues now. You can also get blood pressure issues. You can have issues with nutrients not going back in. These can actually become, you know, problematic too. But it all plays a key role in immunosenescence, because the immune system is in our circulatory, in our blood system.
Right.
And these cells, once they're senesced, they don't really go to the tissue. They won't migrate to the tissue. They won't do anything. They may stop somewhere. They may go somewhere. They may cause havoc, and that's about it. Instead of functioning appropriately or stimulating localized immune cells that do their function, they're not going to help. You know, the immune system works cohesively. Two components to it. There's that immediate response, which natural killer cells play a key role in. And then there's the large army, which is the T cells and the B cells. Those guys are the ones that signal. They're the ones that do the majority of the work after they've been taught by the orchestra or the individuals that started off the problem or try to take care of the problem. They come and do the major attack, is the secondary arm. So what our look is more of a 1-2 punch, and that's why we come up with our thing is cell therapies, work cell therapies. One is our stem cells, and we know this based on clinical studies we have here in the United States, is our particular cells. Not all stem cells are created equal. People out here in the United States are grinding tissue and telling you there's stem cells in there. There's maybe 5 cells in there, 15 cells. You can look it up.
Yeah.
You risk getting an infection because you don't know how this stuff was processed. You don't know what's in it. It comes from all different donors. You don't know how verified these donors are. Every single tissue source that's out there is completely different. And we've gone through 17 years of research to come up to the point where we are.
Well, let's talk about this, because as we've talked about, stem cells are incredibly powerful. You know, I think I've had some injuries, and I don't think that I would be necessarily even walking or able to sit if I didn't get stem cell due to, again, the infection and other things I had. So stem cells can help regenerate, create new tissue, and help essentially your joint get younger, or certain areas of your organs get younger. But as you mentioned, there are a lot of different sources and types of stem cells. right? I think some people might be familiar with bone marrow aspirate. There's a way you can pull your use your own stem cells, pull out of that. Use your own bone stem cells as a source. There are adipose cells from your own body fat, but as you age, your stem cells get weaker. So there's a source that you've used, which is umbilical cord stem cells, which then you multiply. But I'd love for you to walk me through some tiers. I want to first start off with the lowest quality stem cells that you typically find out there. Now, here's the thing that surprises me. There are clinics I've seen charging sometimes $5,000, sometimes $10,000 for this umbilical cord fluid, I think is what it is.
Yeah.
But walk me through, what are some of the lowest quality forms of stem cells that aren't worth our money today?
Well, it varies. So if you look at what's called the perinatal tissues post-birth, they can obtain stem cells from amniotic fluid, which is very few. So all they do is they can do an amniocentesis, or post-birth they can actually get the fluid there. And then all they do is filter it and put it into a vial, make sure it's clean. That's going to vary from donor to donor. There's very few cells in there. The fluid aspect of it is actually mostly antibodies in nature. Remember, the amniotic fluid is actually urine from the baby that's been excreted out with excess nutrients. There is growth factors in there. There is some regenerative properties in there, but it's really low on the hanging, on that part over there. The tissue itself, you can also take that and you can break it up. But the problem with the tissue, the umbilical cord tissue, is that it's like a rope. And what you're seeing here in the United States is individuals are taking that rope, so to say, and they're shredding it, they're removing it, as many cells as possible. But once cells have been through these processes, these difficult dissociations, it's like a rope. It's like a sheared rope is what ends up transpiring, and cells are lodged off of it. The cells are somewhat damaged. Then you have to freeze these cells. Then when you thaw them, there's really virtually no cells in there.
So with that, it's not, the umbilical cord tissue is full of stem cells. It is a great source, but the processing there with a lot of these organizations is the problem.
Correct. The way they process it, the testing that's actually done, and the amount that's in there, what you're given. You're given maybe, they're charging you $7,000 because you're getting a vial that they supposedly thought they froze 30 million cells or something like that, and that's not what you're going to get back.
Let me ask you this. So one option we had when we were working with our midwife, and is, once Chelsea and I have had 2 home births, and so both our daughters were born at home. We had a choice to, I want to say, keep the umbilical cord tissue. The blood, you're right. Do you believe that's a good investment for people? That is a good investment initially in the first stages of your child's life. The cord blood is completely different. There is stem cells in there. They're different type of stem cells. Those are hemopoietic or blood-borne stem cells. The concept behind that is that in the United States, it's approved if you have cancer, you can reconstitute or rebuild the immune system with these stem cells. But there's so few in there that it's a formula that's done based on body weight. So when you store your baby's cord blood, the concept is, God forbid your baby is born with a hematological malignancy, cancer, whatever it may be. There's a list of I think it's 30 or 40 different disorders that are blood-borne disorders for children that they can be born with that. You can now put your baby through a chemo, and then you can actually put these cells in there, the ones that you collected, because they're supposed to be in their most naive form, and you can rebuild that immune system for them so they can be healthy again. The problem is that there's only a certain number of them. For instance, when they do the blood collections, maximum is about 100 milliliters of blood. It's a small bag of blood that they actually collect. That's about the max around there, 100, 120 milliliters. From there, there's a limited number of cells in total. The stem cells only represent a small fraction, about 1% of the total. So they can be billions of cells there, but the stem cells represent anywhere from 1 to 3% of that total. Those are the cells that can rebuild your immune system. But if your child becomes 3 years, 5 years of age, 6 years of age, and is weighing 60, 70 pounds, there's a specific formula that's used medically to do this process that at some point, at some juncture,
you can't use it. You have to find other units. So now you're looking at matches because you have to make sure there's not a rejection fracture.
I see.
Part of it.
So you're not able to use this actually towards these regenerative therapies that you're talking about. This is more just for emergency situations. Okay, so we've talked about these different types of stem cells. One, amniotic fluid. That's one of the more low quality. That's what I've seen, I think myself, marketed the most, where people are talking about, it being stem cells when really there's like no stem cells in there.
Yeah.
So what is maybe a step up from that? Adipose, or what would be
So
next?
your own stem cells, if you're healthy, I would say could probably be better than that because you're going to collect more. So you have more numbers. So for instance, if you were to take about 50 milliliters of your own bone marrow, you're probably going to get in total stem cell wise, probably in the range of maybe 1 million cells, in that range around there, stem cells that you may get, or cells that are valuable. But there's other cells in there that are very valuable. There's so many cells in there, but you get a higher starting population. When you look at what we just talked about, a small segment of cord tissue, a small amount of amniotic fluid, the amount of cells in there is really minimal. What to put in each vial. This is what you're getting. When you do it from bone marrow, you have the ability to get more because you can extract more bone marrow out of yourself as long as you're healthy. There's a lot of publications out there that show, for instance, the bone marrow of a multiple sclerosis patient is nowhere near as effective as the bone marrow of a healthy individual. This is done in mouse models. And then you look at the gene profiles of both of them too. You can clearly say that multiple sclerosis individual doesn't have the anti-inflammatory pathways that are correctly. It doesn't have the vasculature pathways that work correctly. So there's a big difference. And not only that, so if you take them out and then you use them, that's one thing. But if you try to take those cells and grow them, because that's what we do, we grow them, artificially in petri dishes. We purify stem cells, only the stem cell populations, and grow them out. These cells are only gonna, what we just said, they're gonna duplicate and they're gonna get older. So if I took we've done this before several times. If I took cells from a 40-year-old and I started to replicate them, like when I replicate umbilical cord, what we call umbilical cord lining stem cells, at some juncture, those 40-year-olds are going to go to 45-year-old, 49, 55, etc. When I have the right numbers to put back in your body for a therapeutic dose. Because therapeutic doses are pretty much, they're getting there, that we're somewhat getting close to standardizing them. For instance, studies show that 100 million pure stem cells, pure culture expanded stem cells, what we call the mesenchymal stem cells, it's considered a therapeutic dose. The studies that we've done actually show that's a therapeutic dose. It works well.
Yeah. So as we're talking about stem cells here, we've got amniotic, we have adipose, which is from your fat. A bigger step up from that is your own bone marrow. The issue there is that if you're not very healthy, those stem cells are not going to be near as effective as a person who is very active, eats healthy. And again, that person's healthy, their cells are going to be healthier. And then from there, what you do is you'll take umbilical cord, you do a lot of testing, and you grow it specifically. Now, there are several organizations around the world that both harvest these stem cells from umbilical cord tissue, which, by the way, I do want to mention, I'm 43 right now. If we were to harvest my stem cells, even though I'm very, very healthy, they are not going to come close to being as powerful as the umbilical cord tissue of a very, very healthy, newborn.
Correct.
And not even close. And so no matter what, these stem cells are much younger, more powerful, but then you go beyond that and you culture them and you expand, and so you multiply. So you go from 1 million to 100 million or 200 million. So you're getting literally 100 times. Think about that. Okay, again, 100 times the amount of stem cells. Now here's the thing. You can only do that not in the United States, in certain other countries. And so that's why for myself, I've flown down to Cancun, Mexico 4 times, which, by the way, this clinic is state of the art. It is all white marble. It is beautiful. I feel like I'm in the highest end spa in the world when I go in there. In fact, I'll say this, Rafael, your clinic is nicer than any clinic that I've ever been into in the United States.
I believe that.
Oh yeah, it's that nice. And so it's right. I fly down there with Chelsea and I. First time we went down, I stayed at the Ritz-Carlton there. There's the forest. There's all these great hotels, beaches, and but again, this clinic is fantastic. And with that, I know that, again, so going back to the point here, again, I love Cancun. It's been a lot of fun doing the trips down there along with getting the stem cells. But we're not allowed to get these stem cells in the United States. Before we talk about more, why is that? Why is it that we can't get those stem cells here in the United States, or multiply the stem cells?
Because once you take them out of the body and once you try to use them intravenously, it's considered a drug. It's as simple as that.
Now, when did that happen? Because it hasn't always been that way, has it?
It hasn't been, well, it has been that way in the context of doing an intravenous infusion. So putting anything into an IV. If you think of a lot of people, I'm sure you do IV nutrition. I go do IV nutrition, vitamin C, all that's regulated. It's all regulated, has specific regulations, because on any given day, you can have a reaction. From one day to another, everybody commonly uses pushes of glutathione. You can have a push of glutathione and have some kind of allergic reaction or something like that, even using too much vitamin C, not being done correctly. That's why it's a safety thing. In the context of when you grow up these cells, number one is you have to show safety. Our cells, we license our technology to this clinic in Mexico. Our cells have been through FDA clinical studies. We just got approval for FDA phase 2 clinical study for rheumatoid arthritis. We got a phase 2/3 for polymyositis, dermatomyositis, which is a pretty severe autoimmune disease, phase 2/3 study. So they're going into the efficacy part of it. We've done multiple different phase 1 studies that show safety. And then that technology is in our clinic that we actually collaborate with in Cancun, Mexico, and now soon to be Cabo. Too.
And I'm excited about that. In fact, we got it, and there's an event I'm going to be speaking at. Gary Brecka is going to be speaking at. Dan Pompa is going to be speaking at. Coming up the end of January. I want to say it's like January 31st through February 1st in Cabo, and it's a grand opening of the new clinic. And so I'm excited and honored to be speaking there along with these other great, longevity and regenerative medicine experts. It's going to be a lot of fun. Tell me a little bit about the event for anybody who may want to. And I think there's going to be a lot of physicians, a lot of they're going to be there.
Yeah, there's going to be a lot of biohackers there. There's going to be a lot of doctors that will be there, will be present. They will basically, we're going to have everything from the baby steps, the fasting, the diet, the nutrition, the supplements, hopefully the breathing, and then the cool thing is you get an opportunity to hang out with people like you and Dan, and it's going to be a lot of fun, and we learn off of each other, feed off each other. I'll be talking about cells. A colleague of mine that's out of Baylor will be talking about dendritic cells, which are used now in cancer therapies over there. Plus, they're in clinical studies here, phenomenal clinical studies here in the United States. They were just granted, it's like a designation of number one most innovative cancer therapeutic in the United States with a $35 million grant for glioblastoma studies in the likes of Brigham, Stanford, Sloan Kettering, the highest end cancer centers. There's going to be that. And there's going to be a bunch of other colleague of mine at the University of Florida will be talking about clinical applications for specific stem cells that we actually have, the ones that we've done. We'll show you actual data that we have, which is really important because everybody out there, I'll try stem cells, but show me the data on the particular product that you have. Show me what your cells do. We knew two different things that we know about our cells. We know we can increase blood flow, because it releases a specific protein to do so, and we know it can help control the immune system, which is key. I mean, you saw that with an individual that went down there that had psoriasis, and then it went away. Ultimately, that's a chronic inflammatory state that attacks the skin. When you control the immune system without using drugs, which you can do it with these cells, that's going to go away.
Yeah. It's so powerful. I'm excited. I'm going to be talking about cellular longevity, which awesome. All the diet, all the supplementation. I'm going to go through all the herbals, all those sort of things to get in there. And so I think there's going to be a few others talking about cellular longevity, cellular medicine, which I think is really the wave of the future when we talk about what the leading experts are going to be doing. Because we talked about diseases aging. So how do you? There was a great study out of Stanford, and basically they were looking at how different. It's not just that our bodies age; it's that some organs will age faster than others. As you mentioned earlier, fatty liver. That you could be 40 years old and your liver, you could have the liver of an 80-year-old. Right? Same thing with your heart. Same thing with your gut. And so I think, part of that question is this, like the liver regenerates every 150 to 500 days. So like we literally have a new liver every year. Well, if you're continually regenerating, as you mentioned, why isn't your thyroid regenerating properly? Why isn't your skin? What's going on there? And so, that's one of the power of stem cells. That's one of the powerful things about if you can harness the, diet and lifestyle and these things together, your body can regenerate and create the new healthy tissues, and you can actually look and feel younger and reverse your, biological age, even though you're going up in chronological age. And so I'm excited about the event. It's going to be awesome. So yeah, you guys can check the link in the show notes. We'll have a link here to the event if you want to come and check out, again, myself, Dr. Rafael here, Dr. Dan Pompa, Dr. Gary Brecka, and more. Okay. So we were talking about the quality of different types of stem cells. Okay. So again, what I want to do is walk everybody through this. So we've got amniotic fluid. There's hardly any stem cells in there. You've got your adipose. You've got your own bone marrow, your own cells. If you're very healthy, it's good, but it's probably 1/100th or at least 1/50th of maybe the cells that you're going to get from quality umbilical cord if they are expanded and multiplied. Now, there are other clinics around the world, but one thing that caused me to go to your clinic versus others, because there are a couple other clinics in places like Panama, South America, different places where they do umbilical cord tissue, they multiply them, but they don't feed them the same diet that you guys do. And I want you guys to pick up on this, because this is one of the most important things you'll ever hear about stem cells and what to look for. Okay. Just like we should be eating a healthy diet, right? We're made up of approximately 37 trillion cells. And so we are what we eat. Well, your cells are what they eat as well. So Dr. Rafael, share with everybody about what you feed your stem cells and how that's very different than what other people do.
Yeah. Back in 2008, we studied various different diets. And context of diets was actually in cells, in petri dishes. People nerd out with eating healthy foods I was nerding out feeding diets to cells, to what I call my little babies at that time. Basically putting in different formulations and trying to understand, what was good for these particular cells and looking at them in the context of aging. We were studying telomerase activity, which is an enzyme that helps slow down the aging process of cells. We were looking at telomere attrition, so how many, as soon as the cell divides, a telomere gets cleaved and your cell gets older. It's a biological aging test that you can actually take. There's many companies that offer this out there. We were looking at that, and then we were looking at also cell divisions. We were looking at the size of cells and morphology, meaning the shape of the cells. Because what I consistently saw was when we were getting, for instance, if I would take my own bone marrow, which I did, and I took my own fat out, and I would reproduce these cells, it's crazy because as we age, your cells literally inside of you they're bigger. Our stem cells are about 11 microns in size, 12 microns in size. If I pull a bone marrow cell out, an MSC out, mesenchymal stem cell out, and I start to culture expand it from me, it'll start off like at 14, 15 microns in size, and it'll go up as I replicate it, get bigger, larger, and larger. And senescent cells, I think you've seen the video that we have in that publication on senescent skin cells that we actually did, and we had NK cells attacking them. You'll see how big those cells are versus a normal healthy cell. So internally, we sort of internalize, become fat loaded, our cells get larger, they're not as active, they don't produce the right signals, any of that. Go back to 2008.
I just want to say this. It's like being lean, healthy, and fit versus being obese.
Yeah.
Our cells can literally become obese, to your point.
Yeah, 100%. If you look at, when you lose weight, when you're overweight and you lose weight, the only thing that happens is your fat cells shrink. Fat cell stays large and then it shrinks. And similarly happens to cells. The younger the cells are, the smaller they are. And you can see this, and it's every cell type that you look at on a petri dish in vitro as you expand them. As you expand them, they get larger, larger, larger until they become these zombie cells, the senescent cells. Doesn't matter what organ they're from. I've grown up heart cells before, grown up liver cells before, skin cells, all of them, brain cells, all of it. It all goes the same exact way. So what we looked at is particularly this morphology, the size, and then what they release. And one thing that we notice is when we put them on sort of a keto diet, which is what we started off with, similarly when you go on keto or when you protein restrict, you basically first start feeling a little sick. The body has to basically slow down and say, whoa, I can't divide. I'm not used to this. And it stops. basically replicative state. And it doesn't grow well, but it looks like it's just stagnant and it's just basically just quiescent. They're just waiting. Then once the metabolic activity of the cell catches up and says, I'm doing well and I'm feeling well and I've adapted to this condition, then the cells can start replicating. But the neat thing about it is that the cells that replicate off of those are not as aged as if they were normally fed sugar.
Wow.
So we remove essentially almost all sugar from the diets. And standard cells, the way they're grown out there, whether it's a skin cell, heart cell, lung cell, any of that, is you just feed it high glucose sugar, because everything converts in your body into sugar. You put whatever, you put a vegetable in your mouth and it essentially has to form, C6H12O6. It forms that. So it has to form glucose. So we slow down that metabolic process. The cells maintain a youthful state, and we can produce hundreds of millions of these cells at some juncture, which is where we're at now, that we can produce hundreds of millions of these cells from a small segment of cord that are practically identical, which is good because that gives you consistency. Mm-hmm. You don't want variation from one product to another. It's like you want the same supplement every time you take it. You don't want a variation of it.
Right.
You want it to be right on to perform exactly like it's done before. This is similarly to what we have. And our cells, based on telomerase activity and telomere biology, are that of about 15 to 18 years of biological age.
Wow.
And we've done all the testing on it to support it. And we've ran through different formulations of, and even tried it with producing these stem cells from fat, from bone marrow, from placenta. We actually did from placenta too, to see these cells were superior in how they signaled, how they worked, and what we've seen efficacy-wise.
Were you able to test some of the the products that you fed sugar early on? Were you able to tell or get a indicator for maybe the age of what those cells were?
Yeah, we actually did. We actually ran, when we ran standard formulations on there, they prematurely age, including the cells that we use. When we ran standard formulations on there, for instance, the cells that we use have about 8,200 base pairs in that range when you look at telomeres. When we ran standard sugar formulations, when you grow up cells, that 8,200 drops all the way down to about 6,500, which actually puts that at a much older cell.
Wow.
So it's equivalent to when you grow up, like when you start off with a fat stem cell or a bone marrow stem cell of a 40-year-old.
So those cells might be 30%.
So they mature.
Wow.
Yeah.
And so, this is pretty amazing, everybody listening. So what Dr. Rafael is doing is, rather than feeding these cells, which is what every other clinic does, feeding them sugar, which of course we know what that does to us, right? We get, heart disease, diabetes, cancer. You're feeding it a ketogenic, or at least a low carbohydrate diet, helping it feed off of fat instead of glucose, and that leads to a healthier cell, a better stem cell product, which then you can give to patients.
Yeah, not only that, we actually studied in 2014 with Cleveland Clinic, we studied, because each cell communicates with each other. That's how they divide, that's how they replicate, that's how they survive off each other, especially when they're in a restricted mode. So for instance, protein restriction or whatever you may do. We were in the lab, once again, I say, me and my colleagues talk about how crazy was that. We're measuring glucose strips on a daily basis. We're making sure we're putting specific foods in there to make sure that glucose levels don't rise, everything keeps under control. And then from there, once we studied it, we saw that these particular cells help with the 3D that we live in, releasing out a significant amount of extracellular matrix. People take it for granted. The number one protein in our body is collagen. Mm-hmm. You know this. And it's like 90% of the protein in our body, actually. And if you take this for granted, it's the 3D you live in. It forms all structures in your body. The second one is hyaluronic acid. That's another powerful one that helps with everything, especially in the joints. Chondroitin sulfate, the use of that. So the cells that we have signal and release this. So they serve as a supportive matrix. And if you think about it in the context of orthopedics or issues with the spine, with the knee, with the shoulder, this is going to work best for you.
Wow. It's so powerful. And so just remember, it's like anything. When you're buying supplements, when you're investing in your own stem cell therapy, you want to make sure that you're getting something that has a clean, wonderful diet and getting the highest quality possible. And if people do want to learn more about Dr. Rafael and his clinic in Cancun and Cabo, you can go to rehealth.com. That's rehealth.com. rehealth.com and learn more there and set up a consultation. And again, this is something I know that I have done as a therapy. Gary Brecka, Dan Pompa, we all go there. There's loads of professional athletes, people flying from all over the world to get these therapies there. Now, one of the other therapies that I had done as I was on my healing journey was I knew after I was bedridden for a full year, I knew that I probably had built up some senescent cells. And I know this because I did some blood work and I did things like an ROS test, reactive oxygen species, and looked at some of my oxidative stress on my body that happened over that time. And it was very high. And so I went and I worked with you and I got NK cells done. Okay, so not stem cells, NK cells, these natural killer cells. And I really noticed the difference. I mean, I can tell you, I just felt a little bit younger afterwards. I don't think I got sick for the entire year afterwards. It was pretty amazing. Walk us through what NK cells are and what are they typically most used for today and why are they important?
Yeah, correct. So natural killer cells are part of the innate or the immediate immune response. They are the number one cell that's in charge of three things: a cancer or a mutated cell, number two, a virus that attacks your body, and number three is the zombie cell, the senescent cell. It's in charge of those three different things. As you age, the reason why you're more prone to get cancer is because NK cells are no longer natural killer cells. They somewhat become dormant signalers, and we've actually see this. We can actually see this. We can study the markers on this, and we can show you that as you age, and there's publications out there that show this too, that shows you as you age, they are no longer the killers. So NK cells, when they're strong and they're healthy, they kill another cell or they attack another virally loaded cell, a mutated cell, anywhere from a 1-to-1 attack, meaning a direct attack, or they'll do like a 1-to-5 when they're weaker. They'll become 1-to-10, meaning 10 of them. And then at some point, 10 of them need to kill one cell, let's say a virally loaded cell. At some juncture, they don't even kill at 10-to-1, 15-to-1, 20-to-1. You know, you're walking around with billions of these in your body, a couple billion in your body on a regular basis. So what we do, our target more is the senescent aspect, because the senescent aspect also helps indirectly with the cancer aspect. Mm-hmm. If you look up natural killer cells and you look up, for instance, at clinicaltrials.gov, you will actually find that there's thousands of studies of natural killer cells in cancer. We went with the focus of gearing the natural killer cell, your own natural killer cell, towards that zombie cell. Because if I can remove that zombie cell, I can help your immune system battle.
Well, one of the things a lot of people don't realize is that sometimes going indirect is more powerful than going direct. You know, our bodies have so many foreign invaders. I mean, I've taken care of so many patients over the years, and as I've ran a functional medicine clinic, who have come in with not just one virus, but it's like Epstein-Barr and CMV and Lyme and mold, and you know, they have all of these different issues going on at the same time, and their body just is overwhelmed. It can't handle it all. And so one of the great things about NK cells is if you can boost and increase these NK cells, well, now, and clear out senescent cells, well, now you've at least taken care of maybe the bulk or the biggest threat. So now it's like if you're in a fight and you are, you know, fighting 1-on-2 or 1-on-5, well, it's pretty hard to win, versus if you came in and just had to fight 1-on-1 a weaker opponent, you can win finally.
Yeah, exactly. Yeah, so it's we basically take your own NK cells, we grow them up to billions. We activate them. We make them stronger killers. We published a paper in 2022 showing that we do this. And then we looked at specific markers of senescence, these zombie cells. The most accepted ones are one that's actually called beta-galactosidase. It's a senescence marker. It's an enzyme that's on the outside of a senescent cell. It identifies the senescent cells. We reduced that significantly in individuals that were 70, 50, 30, and we're consistently seeing the same thing, that we reduce that immunosenescence, that immune system burden. You know, we wiped out, the other marker we looked at is P16. That's a protein that's part of a cell. It tells a cell whether to stop or go in the replicative state. The older you get, because cells are not replicating as much, the more P16 you have in your body. The younger you are, the lower amount of P16. We put NK cells in, you'll see an individual that's 70 years of age, their P16 will drop more than half.
Wow.
Levels.
It's powerful. I want to mention too, one of the things I've done for many years for people is help them activate their NK cells with nutrition. If you're eating a diet higher in berries, higher in certain vegetables, especially steamed cruciferous vegetables, certain things like organ meats like liver, and then there's a lot of herbals, especially green tea that's concentrated. I mean, there are things that can help boost them up. However, there are conditions to where even when you're doing things nutritionally, your body is still just not getting enough. It's in a position to where it can't fully heal, or, maybe if you did this for years, it can. But overall, if you're a person that's really sick and suffering, I recommend combining the diet with getting NK cell therapy, and it gives you your best shot at fighting these chronic diseases, everything we talked about from cancer to viral and, any type of infection. And that's where we've really seen it shine with those sort of conditions. Now, I know that there are it's not all types of cancer. When you look at NK cells, what types of cancer are they most effective at fighting?
The natural killer cells are studied right now in the context of tissue-based, so some tumors, but it takes many cells to attack and shrink a tumor. More bloodborne cancers. So bloodborne cancers, because a natural killer cell normally doesn't become a cancerous cell, it's the attacker and the killer of other cells that are there. For instance, the NK cell can attack a T cell that's infected, whether it's infected with a virus or whether it's a mutated cell. Some like lymphocytic leukemias, different type of leukemias, bloodborne cancers, it can attack and it can remove it, eliminate it. So it's one of the most things effective of it. But going back to what you said earlier about the diet is key, because we look at it even in the context of the stem cells, and you look at it in the context of the NK cells. For us to obtain a good amount of NK cells and activate them and grow them, you have to help us help you, is the way we look at it. Like, you have to set up the environment. The environment is your body for success. If you're the individual that's eating really bad food, not taking care of yourself, and you've got a medical condition, for instance, an autoimmune disease, a simple one like that, and you have to taking a step back and look at your diet to suppress that inflammatory system a little bit before you're going to get stem cells. You're setting, number one, we probably tell you no. We tell a lot of people, no, we're not going to bother with you because it's a waste of your money and it's a waste of our time. We're looking at finding ways to make things effective. It's going to be a hard sell for your body more than anything else.
Yes.
Because you're going to just be wasting money. If you don't set yourself up, putting yourself in a less inflammatory state, setting yourself up for success, you're not going to get a successful outcome with any form of cell therapy.
You know what's interesting? I'm writing a book right now on cellular longevity, and in part of the book, I'm really combining Western medicine, the science, the things you teach, along with some of these ancient principles taught in things like ancient Asian medicine. And at the very top of the list, when you go and look at what is one of the first causes of causing this cascade of stem cell exhaustion and cell senescence and inflammation and oxidative stress, at the very top of the list is poor cellular communication, when your cells stop communicating. And this is why one of the things that they typically recommend or prescribe in Chinese medicine are mushrooms. These medicinal mushrooms like maitake and reishi, when you look at the literature, they support cellular communication via their beta glucans, these polysaccharides. And so, anyways, getting to your point, like, that's one of the first things, because I think most of the time when people hear about some of these therapies, they think, oh, these come in and just heal you. No, it's actually the amazing thing about your therapies that you're working with is you're working with the body to help it heal itself. Your body heals itself, but it needs help a lot of times in order to do that. You're not doing it for it. You're just helping it heal itself.
Yeah, exactly. If you're the person that has pulmonary fibrosis, comes to us and does not want to quit smoking, you're coming to the wrong place. We're not going to take you. We're not going to try to help you, because you have to make changes to help yourself.
But again, like I said, I know you guys have had so many celebrities, so many professional athletes, and a lot of doctors. I think about a lot of people that I know that have gone to see you. It's these regenerative medicine doctors, it's chiropractors, it's functional medicine doctors who have said maybe they've injured themselves or they've had an issue and they understand how this works. And so I know that a lot of those people, and a lot of lay people, of course, too, as we mentioned, have seen amazing results. One of the other things I know that you have been a pioneer in is using exosomes with people with chronic illness. Share with us what exosomes are, how are those different yet related to stem cells, and how do they impact the body?
So exosome is basically, it's a nanoparticle. and it's a bioactive nanoparticle that exists in your body. It's produced from every single cell in the body. Simply think of the pituitary is the master hormone regulator, producer. The pituitary, in a man, it has to basically, if a man has to produce testosterone, man produces testosterone normally in the testes, but a lot of times there's a signal from the pituitary gland. The only way that signal gets from point A to point B is by a protective bioactive molecule, which is a exosome. It is 1/1000th, around that, 1/1000th the size of a cell. It's like a baby cell, like a little tiny cell. And similar to a cell, it has a lipid bilayer because the contents have to be protected. When it goes out into the extracellular area in your body, when it's in the vasculature, depending on the condition, it can be destroyed. So it has to be able to reach from point A to point B. Once again, every cell in the body produces an exosome, including cancer. It's now known that once you have cancer, these basically vesicles are produced from cancerous cells in your body, and it forms new cancer by this communication to other cells and infecting other cells to form other cancer cells. So it's basically a communication in your body, nanoparticle communication. Now, from stem cells, remember, a stem cell is a cell that can regenerate, has a much longer lifespan, and can help with healing guidance cues, and can form progeny and can form specific tissue types. When you gather and get an exosome from a stem cell, it's a lot more potent. That also depends on, once again, the diet. It boils down to the diet again. Because if you look at, for instance, if you feed an exosome or a stem cell, if you feed a stem cell with a particular protein, at some juncture, if you remove that protein, that stem cell is going to want to say, wait a second, what happened to that protein? I'm going to start machining and producing this myself and start excreting it out. So it can produce these particular signaling cues, these particular proteins. So it depends on where it's from, the exosome, what it does. And number two, it depends how you fed it, because just look at it like there's a bunch of stem cells on a plate on a petri dish, and there's liquid on top. The exosomes are floating in that liquid, and a lot of times it's just a byproduct. There's exosomes in there. There's extracellular matrix in there. There's different proteins in there. We talked about collagen in there, HA in there, hyaluronic acid in there. You capture that, and then you can isolate the exosomes. The exosomes are only as good as the cells that they came from, the stem cells that they came from, is number one. Number two is, think of it like this. There's a big difference between getting a stem cell intravenously and if you were to use exosomes intravenously or use exosomes, period. We use exosomes in the context here in the United States of topical for skin healing, for skin rejuvenation type look, because it helps heal a lot. And it helps, it can help the appearance of skin look so much better on it. But the stem cell, if you put a stem cell intravenously, as soon as it hits right number one, where it goes to is the lung. When it goes to the lung, it sort of has to surveil the area and see what's going on here. And it basically then says, I need to survive because the lung is a different condition than I was in before. So I was in a perfect condition before. Now I'm in a nasty condition and I need to do something. So I need to strive to survive. So it starts to surveil what's going on. And if your body's missing a particular protein, a particular message, the cell itself starts producing exosomes and starts releasing it. So it'll communicate with other cells, not only the other cells that were put in, the other stem cells in there, but your own cells to make a functional change to help you heal. That's how we heal. But the exosome that I put in a plate and I grow up sort of artificially, that I told you about, that we just grabbed that food and the exosomes are in there, those are pre-made. It's sort of like, look at it like this. It can be considered here we go, is a great analogy in supplements. It can be a regular vitamin B versus if I took the methylated one,
that's right,
it's going to be so much more powerful.
Yeah. All right, Dr. Rafael, I want to do a rapid fire here, and I'm going to throw out some different conditions, and I want you to let me know what the best regenerative therapy is for each condition. The first one here is chronic pain, whether it be osteoarthritis, rheumatoid arthritis, could be low back disc bulge, chronic knee pain, neck pain. What is the best therapy for that?
Stem cells basically control the immune system, increase blood flow.
What about autism?
Stem cells, because stem cells will do several things. Majority of children that have autism have gut issues, inflammatory issues. We now know that the inflammatory system can actually penetrate, go into the brain, the central nervous system, and cause havoc. If you can keep that in check, then you have a better fighting chance.
Give me an example of maybe, a child you took care of on the autistic spectrum.
We had one that actually lived close to the beach, and they, the parents complained about we take things that we take for granted. My child cannot walk on the sand, can't touch, so tactile feel, couldn't feel tactile sand, has no eye contact. Mm-hmm. And the other one thing was also doesn't respond when we're talking to them, or if we say a joke, everybody laughs, there's no response at all. Helping with these minor things that we take for granted, like we have, that are parents that have children that can respond to this, that can walk on sand, is something we've seen. We saw a child, mom actually really crying deep down when her son actually went and was walking on the sand and enjoying sand. Having eye contact during dinner, being able to sit down and spend family time during dinner, that they're basically engaged. So engaging more is another key one with autism.
How about for beauty? Someone says, I want my skin to, I want to look and feel younger.
I would also go to stem cells there too. I would say stem cells, once again, I go with controlling the immune system, and increasing blood flow is the key with the skin part.
Now, what's the secondary? Because I've heard you talk about that with actually exosomes as well.
Yeah, with exosomes, it's basically because it's a byproduct. It contains hyaluronic acid, it contains collagen, and it can help you just apply it topically.
How about something like plantar fasciitis or tendinitis?
I would start off with PRP and then go to stem cells next if it didn't work.
Yeah, that's great. How about an issue like chronic infections? We talked about this person earlier. Somebody has maybe Lyme or CMV or Epstein-Barr or mold, one of those issues.
Natural killer cells, 1,000%.
Okay.
Yes.
Yeah, I can see that. Okay, what about somebody that's struggling with maybe a condition like hypothyroidism or Hashimoto's thyroiditis?
Autoimmune conditions, stem cells all the way.
Okay. How about cancer?
Cancer, NK cells, and then there's other different cell therapies that are now on the horizon too.
Just give me a quick synopsis here. Again, a short answer on Immunosine, that therapy. What is that?
It's a dendritic cell natural precision vaccine towards your cancer. The dendritic cell is basically a cell in your body that is in charge of the entire immune system. It is what presents something that's foreign to your immune system to target, to kill it. It does it by particularly picking it up. For instance, if it's a mutated cell, it will take it, it'll chew it up, and it'll present it to your immune system and tell your immune system, activate, go kill. So if you can take, for instance, a biopsy, which is what's being done with Immunosine, you take a biopsy of tumor tissue, you isolate both DNA and you isolate the protein. So you're essentially isolating the entire structure of what that tumor is made up of. You now present it to the dendritic cell. The dendritic cell can now tell your immune system, I need you to make clones and I need you to target and kill this.
What do you recommend for somebody that has type 2 diabetes?
Control your diet.
Yeah, I agree. It is. That's good.
Control your diet.
Yeah, exactly.
Control your diet, but then besides that, stem cells.
Yeah, do all the things we talk about here on this show. Okay, what about heart disease? I want to give you an example of this. I have a friend who had a minor heart attack. Okay, and really had a scare. And the guy is around 60, but and if he wouldn't have caught it, I think by that day, because he just thought, oh, I'm just having, acid reflux. But he went in and they said, you have a minor heart attack. If you wouldn't have come in today, you would have died. And there are so many people. I'm thinking about, and I have a family member who passed at 60 with my father-in-law, and we just didn't see it coming. High blood pressure.
Yeah,
that was the only symptom at all. And so when you think about somebody like that, or somebody that has heart disease, what is the most effective therapy for that?
I've seen our cells work fantastic. I've seen individuals that are in heart failure, that have class 2, class 3 heart failure, improve their ejection fraction significantly. It releases a factor called vascular endothelial growth factor that helps supply a lot more blood flow.
This is stem cells, or
these are stem cells?
Okay.
Yeah. Yep, I would say stem cells 1,000%.
And I think the other thing I love about these therapies is you can do them once you have a problem, but also you can do them to anti-age, to prevent some of these issues in the first place. And that's how I'm thinking about it now. As I've gone through my scare and my trial with the spinal infection and all of those issues, and being told by a doctor I could likely be permanently disabled, I've said to myself, I am really focusing now in the future on longevity. I'm going to be proactive in preventing these things in the future. I want to live as long as possible. I want to be 95 and 100 and still active with my grandkids. And so that's one of the things I love about what you're doing is as well. These can help heal and regenerate. They can also extend somebody's life, and not just adding years to their life, but life to the years. And so it's so powerful. I want to encourage everybody to check out Dr. Rafael Gonzalez's work. As I mentioned, he has clinics in Cancun, Mexico, and Cabo, Mexico. And you can visit rehealth.com. That's R-E-Health, rehealth.com, to learn more. Are there any other places that you want to recommend people go to learn more about you and your work?
They can go to our U.S. entity, thebiobox.com. That's thebiobox.com. We do quite a bit of work here. We have a fantastic lab in California, Southern California, that we do have a bunch of other scientists that work with me. And we're ultimately here to help the masses.
Yeah, well, you've helped so many people. And again, I know myself, Dr. Dan Pompa, Gary Brecka, we've all been big fans of you. And we consider you one of our go-to when it comes to stem cells, regenerative medicine. And again, thank you so much for your work, and so grateful. Hey, I want to say, everybody, hey, I hope you've enjoyed this episode. I want to have Dr. Rafael on because he's had such a big impact in my life in helping me heal and regenerate. And I've referred him so many other people with chronic illnesses, everything from cancer to autoimmune disease. I know children with autism, and the results have really been so powerful in helping people heal and get their life back. There are so many people suffering from chronic issues, and now we do have access to these powerful therapies, even if we have to for me, it's like a 2-hour flight down from Nashville to Cancun to be able to get the treatments. But it has really transformed my life and benefited me greatly. I want to say thanks so much for tuning in here to the Dr. Josh Axe Show, where each and every week we're diving deep into the science and principles behind how to heal your body, your mind, your spirit, and take your health and your life to the next level. Don't forget to subscribe and share. I want to say thank you to all of you who are on mission with me to help heal people naturally. I'll see you on the next episode.